So the research that we did looked at the symptoms across childhood dementias, and we were able to show that amongst children with many different dementia disorders, that it really went beyond just cognition, learning, thinking, memory, communication. The impacts were very marked in terms of behavioural difficulties, sleeping difficulties, movement, and also eating.
It's also important to recognise that in many of the childhood dementias, there is also involvement of organ systems outside of the brain and nervous system. And so that might include liver and kidney disease, pulmonary disease.
Overall, there tends to be a period of sort of the early symptoms initially emerging, and then a period of often more sort of rapid loss of skills. And then there is often, again, a longer period of sort of what we call end-stage disease, where the child might be not able to do very much and be very reliant on a lot of extra help and support. They might have difficulty with feeding, and so that can sometimes mean that they need a feeding tube or a peg. They can have, ongoing difficulty with seizures, and that needs anti-seizure medications. They can have difficulty in terms of contractures, difficulty standing, difficulty with transfers.
And so some children with childhood dementias demonstrate very rapid loss of skills and sadly a very premature death in early childhood. But some children will progress slowly and not present until their teenage years when they're at school and struggling at school. Children demonstrate a progressive neurological loss of function and a premature death across the spectrum of these diseases.
There's diagnostic uncertainty, there's treatment uncertainty, there's the course of the illness uncertainty, so pervasive uncertainty. Secondly, there is prolonged impending bereavement. It is as if grief goes on and on before the child dies. The third thing is, the more the child has already developed, the more the parent faces the disintegration of the relationship with the child. The disintegrating humanity of the child is particularly poignant, particularly painful.
Our systematic review distills common unifying themes from over 19 peer-reviewed articles across the globe, representing the perspectives of over 1,836 parents worldwide. We were able to conclude that the childhood dementias are associated with substantial economic, psychological, and social impacts for the entire family unit. And this is largely due to a widespread lack of clinical expertise in caring for childhood dementia conditions, as well as a paucity of psychosocial services and healthcare supports. This really highlighted the importance of initiating routine psychosocial risk assessments to understand parents' stage-specific psychosocial support needs and responding by working in partnership with families to try and address these needs to empower them in their caregiving role.
We spoke with 8 different families and really asked them to tell us their stories. Parents identified so many challenges. Fundamentally, they come down to 2 different things. The first is awareness and the second is navigation. Parents noticed things about their children and they flagged them. They flagged them with their GP, they flagged them with their paediatrician. That awareness of, that perhaps this was a sign for something else just wasn't there. And that was really difficult for families in that journey to diagnosis. They're usually assigned or attached to a specialist clinician who becomes their primary point of contact. But that clinician is really concerned and is an expert in that genetic condition. But parents and families require a whole load of other supports too. And parents really find themselves having to reach around and do the research and talk to people and understand how to piece together all of those other things that they need. And in doing that, they face a really significant administrative and emotional burden.
It impacts the parents as carers, but it also impacts siblings and also grandparents. So it's across every aspect of their life. The family unit, working, socialisation and schooling, physical health and well-being.